James Warda, Senior Director of Marketing and Communications with the Home-Centered Care Institute, and welcome to another episode of HCCI Conversations with. Today, we have with us Julie Sachs, who's the Chief Operating Officer of the Home-Centered Care Institute. And we also have with us Rebecca Ramsay, who is the CEO of Housecall Providers in Portland, Oregon. She's also recently joined the HCCI board. So welcome. Thanks for joining us, Rebecca and Julie.
Thanks for the opportunity, James.
Yes, thanks.
Rebecca, can you tell us a little bit about your practice?
Sure. Housecall Providers is a home-based medical practice. We have three service lines. We have a home-based primary care program where we serve about 1,600 patients. We have a home-based or community-based palliative care program, and we have a hospice.
Let's go over to you now, Julie. Can you tell us about your role with the Home-Centered Care Institute and what you've been seeing as an organization about the pandemic?
Sure. I'm Chief Operating Officer, and I've been with HCCI almost since it started. I joined back in 2015 and have since seen the organization grow quite a bit in size. Our staff has grown, but so have our offerings. We have seen tremendous growth in our educational offerings and the ways that we can support practices. And of late, we've really seen a growth in the interest of this model of care. COVID really created some greater national awareness of the need for house calls, how they can keep people safe, especially the at-risk population that needs to be out of the hospital.
I would think with everything that's happening with the pandemic, people are having to learn, especially our providers, new skills or doing things in new ways. How does HCCI stay ahead of that and kind of think about, what kind of skills are needed now in this new era, and how do we prepare providers to handle those things?
I mean, HCCI is not a membership organization, but we have practices all over the country that we help, and they share their best practices with one another. And so there's not the need to sort of figure out all by yourself, how are we gonna set up this workflow? How are we gonna reopen? We do webinars, we have a hotline where we can answer questions to help people figure this out without always having to start from scratch.
Right. And Rebecca, back to you then. Do you ever get a sense, as a practice, do you feel sometimes like you're kind of on your own, or is there a community of practices where you are able to reach out, and share not only through HCCI, but directly, what you're all going through and help each other out?
We actually don't feel alone, which is really great. We have organizations like HCCI who are holding webinars and have, the LinkedIn group, et cetera, that are helping to share best practices from across the country. We are a member of the National Partnership for Hospice Innovation. They have also been supporting us quite a bit, and we've been on, we have weekly calls. We have 100 hospices across the country that we're sharing best practices with.
So you talked at the beginning about Housecall Providers. You do primary, hospice, and palliative, right?
Yes.
So how do you, as a practice, work to seamlessly integrate those for the patient and have that, come across as a continuum for the patient?
Our patients in our hospice, about 60 to 70% of them are actually referred from our own primary care program and providers. So there are a lot of opportunities for patients. Patients always have a choice about which hospice they choose. But again, 70% of our hospice patients come from our primary care program. So you can see that it is a very seamless care continuum where patients, when they are nearing the end of their life, have that option to move over to our hospice. And that means that their own primary care provider that they've had often for many years can still be very much in touch with the patient and their care
Thanks, Rebecca. Julie, so coming over to you, what have you seen from HCCI's perspective in terms of the different disciplines, working together, what works well, and how they can be helped to do that type of thing?
Well, Rebecca mentioned being a member of NPHI, the National Partnership for Hospice Innovation, and HCCI's worked closely with NPHI as well and their member organizations, because we've seen really in the past year and a half, we've seen a great deal of interest from palliative care programs and hospice programs, either about adding home-based primary care as a service line to their organization or developing a real solid partnership with a home-based primary care practice so that process is more seamless. And I think there's just a recognition that there is a continuum, and that engaging a patient earlier on and having that relationship carry through is beneficial to the patient. And there's also somewhat of a shared skill set between those different providers. And obviously there's, one of HCCI's primary goals is developing a home-based primary care workforce. And so there may be people that are in palliative care who would be interested in doing primary care, or vice versa.
Rebecca, one of the things that I wanted to touch back on was, reimbursement, right? Billing and coding and the CMS changes and everything going on behind the scenes to actually help a practice stay sustainable. What has that been like for your practice?
It certainly has been challenging to stay abreast of all the changes, but I have been very pleased with how quickly CMS acted and is now allowing a fair amount of telehealth to happen, and the reimbursement rates have been raised. So we're doing okay. The biggest challenge for us has been that our census dropped because we weren't able to admit patients for a good new patients for a good 4 weeks. And because of the 20 to 25% mortality rate in our practice, we weren't able to replace our census with new patients as some of our patients passed on. So that's been the biggest challenge. I will also say that we are very lucky because only 20% of our total revenue in our primary care practice is fee-for-service revenue. We have a lot of capitation arrangements with payers. And so that leaves 80% of our revenue that is not tied directly to the number of visits that we do. It's tied rather to the number of patients that we care for and the quality with which we care for them. We also have about 16% of our revenue, give or take, that is related to the Independence at Home demonstration that we are a part of, where we actually earn quite a bit of shared savings because we are able to care for our patients at home. They don't go to the hospital and the ER as often. So we're able to lower cost while exceeding the quality benchmarks that are a part of that Independence at Home demonstration with CMS.
And Julie, from HCCI's perspective, what have you seen with the CMS changes and the impact on the industry?
That's a challenge to so many practices that we work with that are much more or almost solely dependent on fee-for-service and haven't yet made that switch to being able to do value-based contracting. And, part of HCCI's role and goal is to get practices ready to take on those contracts to make their practices more solid financially and to be able to weather storms like this.
Rebecca, could you talk about CareOregon and the relationship with Housecall Providers and how you came to be, part of that organization?
Sure. So I actually have a 15-year history at CareOregon. About 3 years ago, Housecall Providers was looking for a partner, recognized that the market and the landscape around us was changing. There were a lot of mergers. There were a lot of vertical integration happening in our market, and recognized that house call would be probably more financially stable and able to remain a large community asset if they had a partner. And because CareOregon has been partnered with Housecall Providers as part of its network since its inception in the early 90s, we had a great relationship. We, being CareOregon, had a great relationship with Housecall Providers and relied on Housecall Providers to take care of a very sick segment of our membership. And so we being CareOregon, I'm putting my CareOregon hat on for a second, couldn't imagine not having Housecall Providers in the community to serve our frail elders and our homebound dually eligible members and people who really needed that care model. So it was a bit of a no-brainer for CareOregon to say, if we have the resources, why wouldn't we partner with this amazing organization that has a 25-year history in the community serving high-risk individuals? And honestly, all payers have a very expensive population that isn't as well cared for in a brick and mortar setting, in my opinion. They have individuals who cannot, for a variety of reasons, get into the office as often as they need care. And so payers should be looking for opportunities to support home-based practices, because there is good demonstration that home-based practices lower costs, improve quality, and vastly improve the experience of care that patients have when they have care providers coming into the home.
We're going to end up with a question that we ask everybody who's on these. Basically, HCCI has an I Heart House Calls campaign, and wanted to ask you both. I'll start with you, Rebecca. Tell me, why do you love house calls?
Yeah, so many reasons. Interestingly enough, I'm a nurse, and I started my career thinking I wanted to be a labor and delivery nurse and maybe even a nurse midwife. And so the first job I had out of nursing school was that I worked for an independent birth center that provided support for women who wanted to give birth either in a birth center outside of the hospital or at home. And so I traveled with very, very skilled nurse midwives who were able to support patients having their babies in the home, in the hospital, or in a birth center. So they had all those options. And I learned very quickly the power of taking care and sort of really lowering the anxiety of patients by being in their own home environment, and how much you learn about your patient and your family, and how much more that then informs your care models. And now at Housecall Providers, I get to witness, not personally, but when I'm in IDT meetings, interdisciplinary team meetings, I get to witness the power of a provider being able to share all of the different dimensions of a patient's life that actually really inform the way that they care for that patient and can help them have the context they need to be able to put the most effective care plan in place. So I just think it's really powerful, and it lowers I believe that it levels the playing field. It lowers that kind of white coat anxiety that a lot of people face. And it's really convenient and helpful for patients to have a provider come to them.
That was great. So Julie, I'm going to assume you love house calls. Why do you?
Like Rebecca, I was trained as a social worker, and I used to do therapy in people's homes. So I've experienced it that way before coming to HCCI. And then my very first week at HCCI, I went out on the day of house calls with our former CEO, Tom Cornwell, and was sold. I mean, just seeing the way that the doctor is able to interact. And, I think we've all had the experience of feeling a little bit rushed in the doctor's office, that they need, that you're almost kind of afraid to ask too many questions because you know they have to get to their next patient. And that sense of urgency goes away in the home. And it's not that they don't have another patient coming, they do, but there's a way that it just all unfolds more slowly and with a different level of relationship. And it's just a wonderful thing to witness. And I'm sure for the patient to experience. And then on a more personal note, my mom was diagnosed in her mid-50s with early onset dementia, and unfortunately lived out the rest of her life in a nursing home. And, you know, I just wish every day that I had the ability to offer this kind of care to her. I didn't at the time, but I don't know, I just sort of feel like in a lot of ways, the work I do now honors her, and the recognition that this is what I think most of us would want for our parents and even ourselves when the time comes.
Wow. Well, thank you. Thanks for sharing those stories. Very powerful. I wanted to thank you both for your time. And thank you for watching another episode of HCCI Conversations with you too. Have a really good day. Take care. Bye.